Hi, it's Dr. Ruth the Pain Doc, founder of Chronic Pain Rescue, a telehealth practice committed to helping those who suffer from chronic pain to live with significantly painless lives and to live their best lives. Today's topic that I want to share with you is how can you get a good night's sleep? A lot of times people with chronic pain do suffer from insomnia, and sleep is so important. When we sleep, it's the time for our bodies to revive, regenerate, heal. So getting sleep is really vital. These are some suggestions. Number one, have a routine for waking up and for sleeping at night. Specific time that you wake up, specific time at night that you determine will be bedtime. An hour before that time, turn off all your electronic devices, your TV, stop using your internet, have your smartphone or smartwatch on night settings so that you're not interrupted with notifications. The light screen is dimmer, and just have a routine of what you do to prepare for bed. Some people can, get the help of a practitioner with biofeedback. You can actually learn how to voluntarily cause your body to relax and get yourself ready for sleep. But then there's also things like meditation, visualization, guided imagery that you can use that can help you to relax. Or maybe you're someone who wants to journal at night before going to bed, or reading a book. Those things that are calming, things that should help you prepare to fall asleep. Good eating habits. They're good all around for just about everything. So as I've always talked about, eating lots of fruits, vegetables, beans, legumes, nuts, seeds, cold water fish such as salmon or tuna, whole grains, whole soy foods, mushrooms, herbs, and spices. As far as caffeine, that can be a real hindrance to sleep, especially depending on the time of day that you have your caffeine and how much. Some people, they really can't wake up fully without coffee, or they need coffee just to be able to focus and concentrate. So I do understand that going cold turkey and not having any coffee at all might be too difficult. What you may want to do as an alternative is to have organic green tea, which has half the amount of caffeine, so that you're still getting some caffeine, but significantly less. Of course, you probably want to not have caffeinated drinks late in the day or at night if caffeine does keep you up. So other interventions, if you have insomnia as well as high blood pressure, depression, or constipation, you may want to check if you are deficient in magnesium, and taking a magnesium supplement if you have that combination of insomnia, high blood pressure, depression, or constipation. It could help in more than one way. It could help you sleep and help with these other issues. Also, sometimes people who have a lot of spasms in their muscles also can benefit from magnesium. If you have your blood level checked, having a level of 2 milligrams per deciliter of magnesium in your system is a good amount of magnesium for you to have an alleviation of poor sleep and alleviation of depression. Sublingual melatonin can also be helpful if you have insomnia that's associated with jet lag or with a disturbance in your circadian rhythm. Your circadian rhythm's off. Taking some melatonin sublingually would be a good idea. I want to caution you not to take high doses of melatonin. Sometimes people say, well, I have to take 20 milligrams of melatonin. Really, that's way too much. Our bodies, the pineal gland in our brain, produces melatonin. So when you're taking significantly high doses of melatonin, you're preventing your own body's mechanism to produce it, and you don't want to really do that. So I would suggest only taking 3 milligrams about an hour before you're ready to go to bed. Melatonin does take a while to kick in as far as helping you to sleep. Either 3 milligrams or at most 5 milligrams. And also it's recommended that you only take it, say, out of a 30-day period, take it for 25 days, and then the last 5 days be off of it. Again, just to give your body that opportunity to be without this external source so that, you can continue to have a normal functioning of producing it yourself. Chamomile tea also may be helpful to you. It's good for sleeping, and if you happen to have nocturnal reflux, it can also help with that. Passion flower tea is another tea that you may try to help you sleep. Certain aromatherapies such as lemon balm and and lavender help with decreasing anxiety, helping you to relax, helping you to go to sleep. Also, valerian and hops are supplements that people use to help with sleep. Exercise. I always say exercise is medicine. Depending on the time of day that you exercise can really help you sleeping. Exercising first thing in the morning is actually either aerobic exercise or resistance or strength training. These types of exercises have been shown when done in the morning to help you to have a good night's sleep that night. Some people find walking in the afternoon or evening to be helpful, but just so you know, it could have the reverse effect. It could actually stimulate you if you're walking or doing a aerobic exercise later in the day, have you be more stimulated at night and therefore having a harder time to sleep. So you can see how either time of day, what affects you in terms of helping you sleep. There was one study of 55 participants who noted improved sleep quality, decreased depression, decreased daytime dysfunction, and fewer sleep disturbances when they practiced 70 minutes of yoga 3 times per week for 6 months. There was another study where 22 patients with fibromyalgia have decreased pain and increased total time sleeping from having massage therapy. Also, a study done with elderly patients who practiced Tai Chi found that they had decreased time to fall asleep, so they fell asleep more quickly and they had an overall better sleep because of practicing Tai Chi. So those are some references regarding exercise and sleep. And for further information that you could find help or helping you get a good night's sleep, check out sleepfoundation.org. They do have a 7-day program that you can sign up for where they'll work with you with daily emails and texts to help you with sleeping. So that is pretty much all I have for you today. I want to remind people that if you're considering working one-to-one with me as a health coach, or you're not sure, I am offering free, no obligation, 30-minute phone consultations. You can find a link in our social media and just sign up for that. I'd be glad to help in whatever way I can. All right, until next time, peace and blessings.